TOHETI, or Transforming Outcomes and Health Economics Through Imaging, is a large program of work funded by the Guy's and St Thomas's charity with the aim of improving outcomes in patients and reducing the cost of care, and using imaging along the whole pathway to achieve that. TOHETI covers many different pathways. Outpatient pathways such as those of patients with a chronic headache, to emergency pathways such as those of patients with acute chest pain and patients who have potential fractures. Through TOHETI, we're installing one PET MR system, 2 3T MRI scanners, and 3 CT systems.
In St Thomas's, we've already got 2 forces, and in Guy's, we're going to get a definition edge. The Siemens scanners have a multitude of different kind of technologies that can be used for a huge plethora of different protocols. One of the key pathways is the cardiac chest pain pathway. What we're going to be starting to do is scanning cardiac CT patients on the new scanner and being able to use the various different technologies that the Siemens scanners can undertake to be able to achieve a better quality imaging at a low radiation dose for the patient, which is then going to be able to then improve the patient pathway.
I'm part of the TOHETI group of research studies. My study is looking at how patients with chronic headache can best access imaging, and whether that is via their general practitioner or via their neurologist, and what the most optimal pathway for them is. There are lots of patients who are referred for scans, and those patients sometimes access their scans via the neurologist. I think we can save those patients time. I think we can save those patients unnecessary anxiety and unnecessary waiting.
The research we're involved in is basically about investigating people who fall over, particularly looking at scaphoid fractures, which are fractures of the wrist that occur very commonly and have to date been routinely looked at with x-rays. What we're trying to do is see if MRI is better. The benefits to patients include ability to treat serious injuries that will have an impact on a patient's life. It will allow patients in other countries to be treated more efficiently as people realize what the most efficient modalities are. It will allow us to see how much more effective that MRI is over the conventional modalities that we're using currently.
We hope, on the basis of TOHETI, to change the way patients are looked after in hospital and also across the community. So when a GP picks up a problem, we go quickly to a full diagnosis and either reassuring the patients that everything is okay or getting them started on the appropriate treatment.